Marion, thank you so much for your time on ENCA this evening. Maybe start by explaining to us what is convalescent plasma trial. What does the process entail?
Okay, good evening, Clement. So convalescent plasma therapy is the process of providing antibodies passively to a patient. How it works is when a person becomes infected with a virus, their immune system starts to make up antibodies to fight that virus so that the person can get better. These antibodies remain in the person's plasma, which is a clear liquid part of the blood, for many months. So after a person has recovered from the virus, they can donate their plasma, and then we can give that, which is full of the antibodies, and we can give that plasma to somebody who's currently got that same virus. And it's those neutralizing antibodies in the plasma that then fight the virus in the patient's body, and then hopefully the patient can recover faster and have a milder disease.
Now, so you will need people then that have recovered from COVID-19 willing to donate their plasma. Have you already found them? How's that process going?
It's been a slow process. We're ramping up our marketing at the moment. So far, we have just under 50 donors who have donated convalescent plasma already for us. But we need a lot more for us to be able to do the clinical trial that we want to start next month.
Can anybody donate their blood, or is there criteria they must fit?
Not everyone can donate. There are definitely eligible criteria. So the first one is primarily that they have to have been positive for COVID-19 with an RT-PCR test in the past, and then of course recovered and had 28 days symptom-free. Then they need to be between the ages of 18 and 65, weigh at least 55 kilograms, and have never been pregnant before. And then finally, they have to meet the normal donor criteria. So they need to be in good health, they need to have good iron levels, and they need to have lived a good, safe lifestyle.
And once that component of the research protocol is concluded and you've got people that have donated their plasma, what process comes next?
So then we're going to store the plasma. We're in the process currently now of writing up a second protocol, which is a protocol for a randomized clinical trial. That protocol is in the process of going through approval processes, and then we'll start that protocol where we would like patients to enroll to either get the convalescent plasma or to get a placebo, and then look to see whether the product is actually efficacious, whether it works or not.
And how long is the clinical trial expected to last before you can have those results? And I'm wondering, how safe is this therapy? What are the risk factors?
So to answer your first question, we don't really know. That all depends on how many patients enroll in the study. We hope a lot of patients will enroll in the study so that we can get the answers quickly to see whether it's efficacious or not. From a safety point of view or from a risk point of view, all blood products do come with some small risks, and plasma is no different to that. So we are mitigating the one risk of plasma, which is the risk of getting a disease called TRALI, or transfusion-related acute lung injury, which we don't want to give to anybody who's obviously got COVID. So to mitigate that risk, this is why anyone who's ever been pregnant can't donate, unfortunately, because antibodies in their plasma can cause a thing called TRALI.
All right. Look, thank you so much for your time this evening, Marion from the South African National Blood Services.